Welcome to Medical Myths, Legends, and Fairy Tales. I'm your host, Dr. Alan Christianson. Look, you know that between the latest online fads and the crazy media headlines, it's easier than ever to get confused about your health. And you and I just want to feel better and live longer. We want to know what works. And we can't wait for further studies. We need to make decisions today based on the best evidence we've got. Well, that's exactly what this show is here for. So let's get to it. Hey, Dr. C with you. So, do you or someone you know need surgery? We've had such a backlog of elective surgeries, things that weren't critical, that were put off due to the pandemic. And now more people are getting them done than most any time in the last several decades. But for most of us, surgery is like the most athletic thing we ever do. And athletic as in challenging for our body and tapping into our reserves. It's important to think about it like getting ready for a marathon. I'm really excited to talk about this with Dr. Susan Wilder. She's been on this show before. She's a dear friend, someone I just really deeply admire. She's a conventional doctor, a family medicine doctor, and pretty incredible background. She founded the Mayo Clinic Family Medicine Residency. She served in the Air Force during the Somali conflict. She's trained under Deepak Chopra, Tony Robbins, so she's so well versed in functional medicine, conventional medicine, and just, critical thinking. And she's had a big amount of data she's put out about the importance of preparing for surgery. So yeah, please enjoy this discussion with my dear friend, Dr. Susan Wilder. Hey, welcome back to another episode of Medical Myths, Legends, and Fairy Tales. Dr. Alan Christianson here with you. And one of my dearest friends, Dr. Susan Wilder, is here with us today. So, Susie, how the heck are you doing? Always happy to see you.
I am doing great. Thanks so much.
We've talked about this topic for a while. You've been educating people about how to do well with surgery, cut the risk of complications, less pain medication afterward, less infection. There's so much data around this. And a lot of elective surgeries were stalled over the last year. And now we're at the opposite end of that, where so many were put off. Many people are rushing out to do those surgeries they were waiting on. So yeah, this is wonderful, wonderful timing for it.
Well, having been through my own surgical mishaps and actually having a similar issue happen with one of my kids, and now have another kid facing surgery probably in a few weeks for an orthopedic issue. It's such a critical topic. And it's sadly, we're such a rescue focused culture. We will spend whatever it takes to unblock an artery or treat a cancer or house an Alzheimer's victim or bail out a drowned city, but we won't spend pennies on the dollar in time and energy and effort just thinking about how to prevent all of that. And with surgery, to me, it's the biggest athletic event, barring pregnancy, that any of us are likely to face. And walking in there unprepared is a bit like, running a marathon without training.
Biggest athletic event besides pregnancy. So that's, in terms of the stress on your body, it makes perfect sense, but I've never at all thought of it that way before.
Right. I didn't until I had a pretty horrific outcome from what should have been a minor surgery while I was, a residency director at the top of my game at one of the finest academic medical centers in the world. But I had no idea what I didn't know.
If I can ask, can you tell us a bit about that? Or?
Sure. So I needed a plastic surgery for a skin cancer on my eyelid and a ganglion cyst, not big deals really. And so was going into plastic surgery, and just like everybody else, number one, I assume I'm pretty healthy, which, my eating habits, my sleeping habits, my stress management habits, my exercise habits were pretty horrific. So yeah, I was hanging in there, but I was on a path of sure destruction. And I often say, I am literally 20 years younger now than I was 20 years ago when this happened. Because I've had that wake up call. But so I went into surgery just assuming that, the surgeon and his team will take care of everything. They're all good. And I had no idea how unhealthy I really was. And after surgery, I had horrific brain fog. I lost IQ points that I swore I would never get back. And, in our fields, we can't afford to lose a single one, right? And I was profoundly lethargic to the point where gravity felt too heavy. I had every symptom of fibromyalgia, um, and everything hurt, So it was a really bizarre, setback for me. And I only took pain medicine for one day, but but it was just a horrific reaction. And a friend of mine turned me in onto functional medicine at that point and did some workup on me. And I had profound nutrient deficiencies because my diet of a lot of Diet Coke and Doritos was not not a nutritive diet. I'd been on acid blockers for many years for reflux from my gluten intake and my Diet Coke habit. And I had severe neurochemical imbalances, virtually no serotonin. My hormones were completely out of whack, as you can guess, working 80 hours a week with three small kids at home. And I had no stress management habits at that time. And I also had genetic issues in terms of my ability to process some of the medications that were given to me, which ended up being a really serious issue with one of my kids a couple of years ago in her surgical experience. They put her on a scopolamine patch, unbeknownst to me, the night before surgery. And this is another major medical center, one of the best places in the world. But they hadn't done an appropriate preoperative clearance, at which point they would have seen that she is a CYP2D6 poor metabolizer, couldn't metabolize that drug. And basically, bottom line was, she was supposed to work that morning at 7, have a biochemistry class at 8, and then I was picking her up at 10:30 for the surgery. I had texted her all morning, hadn't heard back, just figured she was busy. Tried to get a hold of her at 10:30 and couldn't reach her to pick her up for the surgery.
Wow.
Had to get the police to basically get me into her dorm room to find that she had just been knocked out through this whole thing by this drug that she couldn't process, and I didn't even know she was, utilizing.
Wow.
So yeah, what you don't. Yeah, I just put a blog on the Medium called "What Your Doctor Doesn't Know Can Hurt You."
Mm. So big things, and even in situations to where you'd think it was more diligent. So the part of the occasion for this is just the book that you've got out, educating people about how they can have better surgical outcomes, surgery, getting proper title, secrets of surgery success, take charge, heal faster, comprehensive step-by-step guide. So I thought if you could just share like maybe one or two teaser steps, general ideas about this. There's more than we can cover completely in the episode. But I thought
Right.
just a couple ideas across. I really want to go pick up the book, go through the program in detail. If you're doing a surgery electively, and you don't always know when you will. There are times where things happen and it's not planned. So it's good
Yeah.
to be prepared. Yeah.
Right. Yeah. So, the program is designed to really empower people to get themselves in optimal shape, and you can do it in as few as 2 weeks. Ideally, if you had a month, that would be the best to really, start incorporating some of these things. As I learned, it took me a decade to undo a lot of the damage that I had unwittingly done by my lifestyle, right? So, and normally, we're telling people to make these changes gradually, maybe get rid of sugars and processed foods, and then maybe try a couple weeks off of inflammatory gluten grains and see if it makes a difference with how you feel, etc. Well, I'm throwing people into the deep end a little bit with the book because the whole goal is you're training for a marathon. So, the entire first chapter is focused mainly on nutrition and, just consuming a healthy, whole food, anti-inflammatory diet. The second module or chapter, and there's an online program under optimizesurgery.com that is a little bit more in depth than the book, but covers the same things in modular fashion. People can pace it at their own pace, and lots of handouts and little tips. The second uh, module is based on is probably the most intense, and that's on enhancing our ability to clear toxins, which was one of my biggest challenges. So any subsequent surgery that I did have to have, I was well aware and able to kind of prep my body so that I could clear those toxins, make sure my GI tract was clearing things appropriately. I was staying well hydrated and clearing things through my urinary tract, that you're clearing things maybe through the skin, either through sweating or through infrared sauna, or, a similar type of a treatment, dry brushing, that kind of thing. Epsom salts baths, if you can do it, kind of depends on the procedure. And the whole point is, um, start these things in advance of surgery, as advanced as you can be. And these days, you're right, a lot of people had put off things, and then this last few months has been a crazy, um, mad rush to get a whole year of messy buildup caught up. But the more time you have, the better. And I have some patients where I will say, you are an inflammatory mess right now, and or an anxietous mess, and in neither of those states should you head into surgery. And if we can stave it off until we get those things under control, there's a whole section in the book on mental preparation for surgery and being in the right mindset. I just talked to a patient the other day who had a facelift that, the outcome was not ideal. And she said, 2 days before this, I just had a feeling that this was not a good idea,
Wow.
but I went through with it anyway.
Mm.
And yeah, we just know that that's not, listen to your intuition.
Wow.
So
You talked about the IQ points, and so much of it, it really is effects on the brain. I remember, this, being my doctor, you checking me out every so often. I had a big bunch of surgeries many years ago, and a few weeks after one of those, I remember had some writing. I was working on some project, and I wasn't planning on getting back to it just yet. But I thought, oh, I think I can get some work done. So I wrote a few chapters and thinking, hey, this isn't so bad. I'm pretty clear and pretty sharp. And then, like 3 weeks later, I went back and read it. It was gobbledygook. It was ridiculous. So,
oh my
yeah.
gosh.
So not only,
Yeah,
not only,
scary. Right.
so not only is our performance compromised, but our self judgment gets compromised too.
Well, I had a similar story. I tried Ambien once. And again, not before I knew about my own genetics and how how I process drugs or didn't. Took it, in the late in the evening, and maybe 10 hours later, was driving with my kids to the office that I'd been driving to for, many years. And I felt fine, totally fine. But my daughter says, "Mom, where are you going?" I totally going the wrong direction. No idea. I mean, that was, believe me, that drug went out the, very scary. So yeah, that one of the pieces that I cover in this chapter, or is in the book, is having an advocate too around surgery, whether it's your primary care physician, your naturopathic physician, nurse, a family member who's got a little bit of medical savvy, but somebody who can hear for you and speak for you when you're not really with the program, especially within those first, few days or even weeks after surgery. Because yeah, everybody needs an advocate. I mean, so many of the stories I have in this book and from my own family, again, I don't care how great the medical center is. Many of these stories were at some of the best of the best. Were people who, either their care was downright negligent, or the medical team wasn't hearing them or listening to them in some way. Of course, our nutrition in hospitals this is something you and I need to partner on, because we are feeding our sickest patients the most unhealthful food. It just boggles my. I had a patient admitted recently for nutritional deficit after pancreatic cancer surgery that she'd survived.
Mm.
And I come into her room and here's a tray full of apple juice, orange juice, jello,
I was gonna say
uh,
Jello.
pudding. I mean, it was like,
Wow.
and an Ensure, full of high fructose corn syrup. I mean, it was like the most. I wanted to throw up, and the nutritionist didn't even know, couldn't tell me what her caloric needs were, what her protein needs were, and what she was actually consuming.
Oh my
So I
goodness.
took action against that nutritionist. But I mean, it's mind boggling.
And the data on it is so strong. That's one reason I'm excited about this book. I've seen some data about just how relevant it is, one's protein status, micronutrient status, overall energy balance coming into surgery. It's such a huge thing for pre and post.
And it's the one major neglected thing. When we look at surgical safety, we do these preoperative clearances that are absolutely proven to have no benefit
Oh,
in
wow.
preventing or averting adverse outcomes. Now, again, if we were doing pharmacogenetic testing or, some of the more advanced things, that there might be which honestly we should all have at birth, and just have an app that any drug that gets prescribed gets run through that app, or ideally through our prescribing systems, which I've been trying um, unsuccessfully for 25 years to incorporate this information, so that if anybody does try to prescribe something that a patient can't tolerate, it actually will flag the provider. But that's still in my dreams. But um you know
Pharmacogenetic data has been available that long?
oh
Or
yeah, there was a company I worked with when I was at Mayo 25 years ago, that called Signature Genetics. That was among the first that I saw. And
okay.
now it's fairly widespread, but the problem is because our systems are not set to handle that. I mean, I had to educate the anesthesiologists and surgical team at Washington University in St. Louis, one of the
Oh,
best medical
wow.
centers in the
Right.
country,
Yeah.
about the pharmacogenetics of my daughter. And oh, by the way, she can't do the scopolamine, nor can she do the meclizine you were going to give her in the operating room, nor can she do any of the narcotics you were going to send her home on.
Wow.
They didn't know that. And they didn't, I tell patients when I do that testing, and I don't do it as often as I'd like to, because like I said, I think we all ought to have that at birth. That should just be part of our newborn testing, and it's kind of plugged into your health record from day one. But I tell patients, look, your providers won't know what to do with it. And Danny, now my daughter, now has a medical alert bracelet that states, please, if something happens to me, please do not prescribe, you do not put anything in me without checking this website, that has the pharmacogenetic links on it.
Hmm.
um, so yeah, it's a real frustration, because yes, this testing has been around for decades.
So that's
And
huge. One little pearl in the book is pharmacogenetic testing, having a sense about what you may have adverse reactions to and to preempt that. You talked about having an advocate, huge thing that people may not have thought of. So this is big.
right, and there's an extensive uh, appendix that goes through pretty much every possible side effect that you could consider, what preemptive strategies you could make to prevent that as much as possible, what to look for, and when to really at, scream for help if you need it, if some of these red flag symptoms are coming up. Um, and sometimes you really have to scream. I had a patient who, after a surgery, this is the one time I used to say nobody could overdose on a vegetable, right? Well, uh, that rule has been broken. And a patient eat a huge bowl of Brussels sprouts and basically get a bowel obstruction.
Oh
And
no.
that can, because it's a tremendous amount of fiber, right? And then that surgery ended up getting very complicated. Um, And at one point he was having such severe pain and they were sticking like lidocaine patch on his stomach. And I'm in there going, whoa, 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 whoa. This is not normal. He needs to be scanned, etc. It ended up being massive infections. And and this is an intensive care. Yeah, I mean, again, you don't, everybody needs an advocate. That's all I could say.
What's one closing? What's like one top tip for a couple weeks pre-op that someone should start on right away? Like there's several in the book that are there, but what's one that
Yeah.
jumps to mind? A dietary
Mm.
one.
I would say probably the most important dietary one is to really front load with, organic, colorful fruits and vegetables and greens. And so my favorite like cheat, in fact, one of my patients calls it green slime, but my favorite easy way to do that is Costco sells Suja organic mighty greens, or I think it's organic mighty greens in a big bottle, so it's not super expensive. And front load with 4 ounces of that before breakfast and 4 ounces of that before dinner, and you're getting the equivalent to about probably 8 cups of organic variety of fruits, vegetables, and greens. So you get those phytonutrients that are so critical for healing every cell of your body, for clearing toxins, for supporting your hormone system, your neurochemistry, your nutritional status overall. I think that's the easiest.
Enterohepatic recirculation, all the junk that gets sent out that comes right back, the chlorophyll, the greens, they bind with that. That's really cool.
Yeah, well, and I'm a big fan of, well, having been a mother of three with crazy work schedule, I'm a big fan of prep big things in advance. It's real easy to do a big vat of veggie full soup. It's real easy to do, roast a whole variety of vegetables that you can then blend into smoothies. You can throw, together for a bowl or a dinner. So prep in advance, think about that, or look for healthy delivered meals after surgery, so you've got an easy way to make sure you're getting the nutrition you need. There's so many great pre-prep meal options out there now too.
Did I ever tell you my 5-a-day trick?
No.
You might like this one. So this was a similar idea, a little bit more involved than the pre-made, but yeah. So thinking about like a good blend of phytonutrients, thinking about super easy things that don't require frequent purchasing, long shelf life, compatible tastes. So the idea is 5 ingredients that are distinct and adding different flavors, different phytonutrient profiles, but you can just throw into a blender, with some water and
Right.
hit go, and there it is. So frozen blueberries, Roma tomatoes, celery hearts, spinach leaves, and carrots, baby carrots. Yep.
Yep.
So
Listen, you
all,
get every color, the whole
all
rainbow.
you get the colors, you
Right.
get the rainbow. They all last for quite a while, so you can shop like once a week and have that. Actually, frozen spinach works really good as a pinch too. But yeah, you
Sure.
get like a handful of each, some water. That's it, and it's
I love
really
it.
good. It's kind of
Yeah,
a
that's a
the
great
blueberries
idea.
and the greens. It's like a kind of a darker color, but it tastes so good.
I love the organic blueberries from Costco, and I never can eat them fast enough. So I always freeze at least half of them. So I do that exactly kind of thing. Also, Costco sells some organic smoothie packets that are greens and berries, and so they're a simple open dump with liquid, which I usually put in the Suja. But even my husband can do that one, and he's not, a kitchen. Um, his has to be, open and eat. I mean, that's has to be about complexity.
A man and can and a plan.
Right, exactly. Right. Yeah, yeah.
Well, this is really cool. So, listeners, if you're not getting some elective surgery, you probably know someone who is, and consider being their advocate. Consider helping to guide them through that process, and encourage them to get Dr. Wilder's book. Pick it up yourself. Share a copy. This is a huge difference. This can just completely transform. And I think that our health, there's a certain amount of, it's a lot less than we think, but there is some decline we cannot escape from aging. But that's smaller than what most people go through. And there's ways we can increase our health, our improve our weight or fitness or whatnot. But the biggest thing is how many setbacks we have. Because the big setbacks, you can only improve so quickly, but you can go
Right.
down pretty darn fast. And for
Yeah.
many people, yeah, these events, the surgery, even when it goes well, it's a big stressor. But when there's complications, that can take someone down in ways in which they may not regain from. So you want this to go as well as possible for you, for sure.
Yeah. Yeah. I call it health stewardship. I think actually one of the silver linings that came out of COVID is an appreciation for our health, and hopefully, a little bit more commitment to our personal responsibility in supporting it. Most people, as just like I was when I was residency director at Mayo, I could have board scores in the 90th percentile and I had no clue how unhealthy I was. So, most people don't even know what healthy feels like. And one of the exciting things about people who've gone through this book or the online program is I'm seeing health changes if they really incorporate some of these habits long term. This is changing their health trajectory for life. And nobody should go into aging in pain. Nobody should outlive their kidneys. Nobody should need vascular surgery, in my opinion. And nobody should outlive their brain. I mean, our goal is to get to a very old age without any of that disability. But the US stats are, we're like, I think 38th in healthy life expectancy. I mean, you do better in Uruguay and Costa Rica and uh, and Cuba. Seriously, I mean that's pretty sad, especially given what we're spending on
Yeah.
health. So we are over doctored and underwell.
So this is great. I'm going to get all the links up for everyone. Links to the book, links to the online program, links to Dr. Walter's practice. So thank you so much. Always a pleasure to be with you.
Likewise, Alan. Thank you.
And to everyone, thanks for being with us as well. And I'll see you back soon for another episode of Medical Myths, Legends, and Fairy Tales. Until then, take great care.
Hey, Dr. Christianson here. Thanks so much for joining me for another episode. Is there a topic you'd like me to cover? I'd love to hear from you. Just go to Dr. Alan Christianson on Facebook or Instagram, write your question, and use the hashtag Medical Myths. Did you find this show helpful? If so, please take a minute and leave us a rating on iTunes so that others can know. Thanks much. I'll be back with you real soon. Bye-bye.